talk about that again. Okay. So Lorna, you've had all of these moles. You've got them really all over, haven't you?
Yes, that's correct.
And have you had them? Is it all your life?
Yes, nearly all my life.
Were you clear as a child?
Pardon?
Were you clear as a child?
No, not 100%. No.
Right. So have they grown more of them?
Yes.
And bigger?
Yes.
Right.
That's correct.
Okay.
Yes.
So before you came to me, which is how many years ago is it now?
It's seven
years,
and a half years ago.
Yeah, that's from
Yeah.
What effect was it? Was it restricting what you do? How did it make you feel having these things on you?
Well, the ones on my eyes.
Oh yeah.
The ones on my eyes. I looked tired all the time, and thought that I had been to the doctors to see if I could get, but it wasn't. You weren't able to get them removed.
Oh, so you went to the NHS?
Yes, I did.
And it was not covered?
That's correct.
Yeah.
I went for NHS because they were blurring my vision as well, because my eyes were heavy and...
I do remember that when we did them on the lids, there were quite a few.
That's correct.
On each lid. They were heavy, weren't they?
That's right, and you thought I would scar.
Yes. Because
the ones on the right eye were quite big.
Yeah, and
you were a little worried that they would scar.
They were big and they were close to the margin.
That's correct.
But they healed up okay, didn't
Yes,
they?
I have a very, very slight scar, but there's nothing to worry about. I don't mind it at all.
And looking at it now, your eyes, you've not got anything going on at all.
No, I can wear makeup.
Yeah, oh yeah,
I can wear makeup now.
Yeah,
Look.
yeah.
Well, I feel better.
Yeah.
I smile more.
Yeah, because the eyes were the main event, weren't they?
Yes,
The first time we met.
That's right.
But after that, we moved on, didn't we?
We did.
And we started
to the neck.
The neck. We did the neck, the back, and we carried on over several sessions.
That's correct.
So, again, going back to before.
Yes.
Did having those restrict say what you could wear, like a plunging neckline or swimwear or something?
I never wore a plunging neckline. I was always covered up to here.
Right, yeah. It was. I think it was an awful place to be, wasn't it? Having all those things.
It was a very nice place to be.
Yeah, and I remember the first time we met, you were a little bit upset about it when you were telling me the story. Yeah. So I'm delighted it's looking better. So what we've done is we've done a number of sessions, haven't we? Worked our way around.
We have.
What I'd be interested to know is from your perspective, when I do the procedure, as you know, we put the local anaesthetic injection in, then I remove the mole, skin tag or whatever using the microwave scalpel.
Yes.
And then you don't get any bleeding.
No.
But you get a little scab, don't you?
Yes.
So tell me what it feels like from the moment I start injecting you.
It stings, and it also depends on where it's stinging. I found my legs were worse than my eyes.
Really?
Yes.
Right, okay.
I did. Especially up here.
Right.
When we did these up here, were more painful than the ones in my eyes.
So the injection, because the anaesthetic injections are irritant, they sting as they're going in, don't they? And then it numbs up.
That's correct.
Now once it's numbed up,
yes,
and I started removing them, did you have any pain with the removal?
None whatsoever. Absolutely nothing.
Super.
No pain or anything. Absolutely nothing.
And then when you went home, after about an hour or so, the anaesthetic would have worn off.
That's right.
What did they feel like then?
Odd. That's the only way I can explain it. They weren't painful. The ones on my eye, I felt like I'd been hit in the face, like as if I'd had a knock.
Yeah.
Like a little bit of a knock. But it wasn't painful, and I had to take pain tablets.
Right.
Never took any pain tablets at all, none whatsoever. I just felt, when I had these big ones done on my eyelids, I felt like I'd been 10 rounds with Mike Tyson.
Yeah.
But I didn't take any pain.
But the body ones weren't as...
No. The ones I had done on the back, on my right leg, those were sore. That my right leg was a problem, but my left leg was perfect.
Right. And we didn't get any infections, did we?
I had to come and see the wound
check
and everything. Yes, but that's because we watch it because I'm a diabetic.
Yes. So that means you're at much higher risk of infection.
That's correct.
So we do, well, either I or Sister Leslie Ann do the,
that's right.
The wound checks.
But she was happy. Yes.
Yeah. And then they turn into scabs, don't they? Come off.
They did, yes.
And then you end up with slightly pink skin, which
I've still got at the moment.
Yeah.
But I'm using the bio oil.
Yeah, lots of patients use bio oil, and it seems to work extremely well.
Yes.
And I recommend now people use it from a couple of days after I do the procedure.
Yes, I've only just started using it.
Find that very helpful.
Yes.
So the final question really then is, having done everything,
yes,
and we've worked from top to bottom, haven't we?
Yes, we've still got some more to do.
Yeah.
Please.
How do you feel about yourself now it's done compared with how you were before we met?
I feel great.
Yeah.
I feel, I don't want to get emotional, but I feel pretty. I feel it's been worth every bit of money spent.
Oh, that's lovely.
It's been wonderful. I feel like $1 million.
Oh,
I do.
Thank you.
I do. I really do.
That's such a compliment.
Don't film.
No. But thank you. That's such a compliment. And how's your life changed now?
I've met someone.
Oh, fantastic!
I've met someone.
So you feel better and more confident about yourself, do you?
I do. Yeah. I do. I certainly do.
Right.
I feel much better.
Well,
I don't feel like I'm an old hag.
Oh. It's just a very unfortunate condition for you to have, and I was so sorry to see how badly it affected you when we first met, and I am now so pleased that all that work has paid off.
Yes, it's been worth every...
And you've met somebody.
I have.
That's fantastic. That's fantastic.
I certainly have, yes. It's all new still, but...
Perhaps we'll have to add that to one of our clinic services then.
Yes.
That's brilliant. Thank you very much
for thank you. I'd
talking
like to
about
say,
it with me.
You're more than welcome, and thank you, Dr. Berrisford. Thank you so much.
You're welcome.
Okay.